Welcome to the NSCHBC Edge Podcast, leading the way in the business of medicine. Now here's your host, Terry Fletcher.
Hello, everyone, and welcome to the NSCHBC Edge Podcast. I'm your host, Terry Fletcher. The Edge Podcast is brought to you today by the National Society of Certified Healthcare Business Consultants. Our goal is to discuss healthy business principles, have conversations on the business side of medicine, so that you and your practice can thrive and be profitable and successful for years to come. As many of you know, the NSCHBC is a proactive organization with over 300 members, including legacy members, that share their wealth of knowledge and expertise with each other, whether it be in legal field, the accounting field, the revenue cycle management field, the business management field, value-based care, physician practice profit centers, and more. We have every kind of consultant that focuses on the healthcare industry you could want. I'm happy to welcome NSCHBC member, healthcare attorney Ericka Adler of Rotzel Law Group in Illinois. Ericka has over 25 years representing individual providers, physician groups, and other healthcare entities. She focuses her practice on regulatory and transactional healthcare law, in compliance counseling, structuring, and implementing complex joint ventures to comply with state and federal laws and regulations. Ericka also has deep experience dealing with Stark, anti-kickback statute, fee-splitting concerns, and the corporate practice of medicine and other challenges facing healthcare providers. She keeps up to date on her weekly podcast, Rotzel Healthcare Law Hotspot, and Ericka also contributes to the law and malpractice section of the online magazine Physician's Practice and to the business section on the online blog site for Medscape, where she addresses legal and management issues facing independent physician practices. So with that said, Ericka, welcome to the Edge Podcast.
Thanks for having me. Glad to be here.
Good. It's good to have you. So we are really tackling a topic today that, it's a little bit sensitive for some medical and dental practices, but it's an important topic, especially at this time of the year when physicians and dentists are looking at revenues, compliance, profits, and things for the coming year. So what Eric and I are going to talk about today and discuss is medical and dental practice theft, how to spot it, how to audit it and monitor potential issues, hopefully some preventative measures. And I can't think of a better healthcare consultant to discuss these topics than Ericka. So here we go. So when we're looking at theft in a medical practice, and it's really unfortunate because unfortunately I'm in the revenue cycle management sector of healthcare and I see it often. How do you first identify it when a provider, whether it be physician or dentist or practice administrator, when they suspect something? Because obviously, as soon as they see it, they're like, uh-oh, who do I call? Do I call the DA? Do I call a consultant? Do I call a lawyer? What do I do?
Well, that's a great question. I mean, unfortunately, sometimes we only get the call once it's suspected that something's going on. And at that point, really, we've noticed money's missing or some type of irregularity. And then, of course, before anybody can be accused of anything, the financial consultant or accountant plays a really key role. What we like to do very often is talk to our practices about prevention, and then if they do suspect something, how to react really quickly. So we really focus on, making sure it doesn't happen in the first place, because as a lawyer, I'm really not going to be the one looking at anything financial or spotting anything. Yeah. But I can tell you from having done this for a long time that this is a pretty common issue. It comes up very often, more often than some people would realize.
It's scary to me to hear that, but it's true, right?
It is so common. I recently gave a presentation on this, and some of the numbers that I saw were that, more than 85% of the people doing this had never actually been charged or convicted previously. And 1 in 4 of the employees who actually does embezzle or come up with some kind of scheme has actually been employed with the practice for more than 10 years. People less than 25 years of old often steal smaller amounts, like about 18,000 was the average, but people over 60 years old often stole larger amounts, closer to 500,000.
This is staggering to me.
Yeah, crazy. I think the thing that would surprise people is that it's not the younger new hires that are usually the ones that are doing this. It is the long-term trusted employees. And I can tell you that in every one of the situations I've addressed, that has been the case, that it is somebody that the practice highly relied upon, believed in, and trusted. And so some of the reasons that this happens, and these are the red flags that we often tell our doctors to look out for, even if it's usually somebody so close and trusted and loved, almost like a family member, right?
Yeah.
But things that kind of make this happen would be a change in the financial situation, a divorce, a financial hardship, a loss of a loved one who maybe was, a breadwinner, a child going to college. So there's usually an event that occurs in somebody's life that is the trigger. It's not just somebody who worked for you for 20
Yeah.
years and suddenly became a thief,
Yeah.
It's usually a life event, right?
Well, this is interesting because I don't know how long you've been in healthcare, but at least 25 years. I'm in my 40th year, believe it or not.
Right.
But I'm okay, so I'm going to go back to when I started in it, I was 17 working for a provider. But when I was looking at it back then, we had pegboards. Oh my God, I just aged myself. We had, paper checks. There was no electronic anything, not medical record, not billing, not anything, right?
Mhm.
And obviously now the copay is still an issue because a lot of patients still pay cash. But it would seem like it was easier back in the day probably to do that. And then also, because it was hard to track because you didn't have the digital option to track it as far as IT. But it seemed like also back in the day, and I'd say maybe 25 years ago, it was more about kind of spouses that worked for the practice or family members. I know I saw when I would catch it. But also it just seemed like, I don't know, it was missed because it was so much easier for somebody who took in the mail to see that check and just, put it somewhere where it could be hidden and then kind of write it off. But fast forward to 2024, how is it really even possible now? I mean, it seems like with all of the checks and balances and compliance and digital footprints and stuff, how and accounting, how does it really happening?
Well, in my experience, in a lot of practices, things haven't quite changed as much as you would think. Um, in the larger organizations, there's a lot of checks and balances, and I do think they catch more of it, and it's a lot harder to do. But in a lot of practices, physician, dental, whatever it may be, a lot of them are still smaller operations, very unsophisticated, even though maybe, I don't know if they're doing paper checks anymore. But usually you have this right-hand person who's somewhat controlling or territorial. They work long hours. They don't take a lot of vacations. And, these are the kind of like, a lot of times when something does happen, my doctors don't have the passwords to anything. They can't access the accounts. They can't do anything. So even though it's electronic, they don't even have those passwords. They're not even a signatory. They're not copied on those emails. Nobody knows who they are. So I think we've just kind of found a new way of kind of stealing and being secretive, even though it's become electronic, right? And when somebody doesn't want to be found out, they get more and more creative. They don't let anybody else have the information. And doctors are very trusting. Often they have this right-hand person who's been with them for years, takes care of everything, pays the bills, pays the employees, helps them run their practice. They have no reason to question anything.
Because it
And
would be
until
kind of enough.
something
Yeah.
comes up, we don't realize they turned over their entire practice.
Oh
So,
my gosh. Well, it's funny you say that because when I find it, and I'm not looking for it, it's funny, I'm not looking for it, and all of a sudden they're saying we need to do an audit, we're looking for this reimbursement, and I said, okay, well, I need to see this, that, and the other. And so I am seeing some of the financials, and then I say, well, I need to see your EOBs because what I'm seeing posted here isn't correct because I deal with fee schedules. So then I look at the fee schedule, I see what's posted, I'm like, can we go a step further? And I try not to put them in a panic to start, but then all of a sudden I start to see, you know what, I hate to bring this to your attention, but look at what's posted, look at what was written off versus what actually came in, you have a problem. And you mentioned two words, territorial and protective. And somebody who just refused to take a vacation. It's like they don't want anybody to see what they're doing. And
Right. Right.
and you're right. It's somebody, unfortunately, that's been there a long time. Now, we've seen and I hate to call it petty theft because theft is theft, but we've seen, patients paying cash at the front desk and that somehow disappears. And we don't like that. But and that's pretty easy to figure out at some point, mainly if patients are asking for receipts. But some patients don't. No, that's okay. I trust you. I hear that all the time, even when I check in at my doctor's office. But it's interesting because I'm just so dumbfounded that we still have it nowadays. But you're right. A lot of practices are still not. I mean, they're still working off of QuickBooks, or they're still, and that's even
Right.
high tech for them. So
Yeah, and they don't have internal control, so they don't have multiple people who do the same job who are looking out, like checking each other's work, right? Or they have limited number of personnel. One person wears a lot of different hats, right? So I can see how it happens, and doctors want to practice medicine. They are very trusting, and although some are very business savvy. I have to say that a lot of them are not. And when they bring someone in who seems to be doing a great job and is controlling everything for them, they are very grateful for that, and they often don't question things. So,
the one thing I saw, I don't know if you've seen this, is I saw a practice, and this was a couple years ago, and they were billing for services that weren't rendered. So the patient would get an EOB, they'd call the billing office, say, "Hey, you billed me for a surgery that didn't happen." The person at the billing, who was the one that was the thief, they said, "Oh, you know what? I'm sorry. We're going to go ahead and refund that. Don't worry, you don't owe anything." They'd zero out their account, but they never did refund it. They kept it. And because the patient didn't have an out of pocket, they never followed up. So it's interesting when I see that kind of thing. I mean,
right.
and people wonder why healthcare is so expensive.
Right. And a lot of this is not like big thefts, right? Like it's a lot of
Right.
small transactions and, they go unnoticed and then it adds up to a lot at the end of the day. So you can get away with it for quite a long time, and of course, some people do way more sophisticated things like, fake invoices, or, coming up with, paying bills for things that were never provided. But that's true fraud, right? I mean, that
Yeah.
is really a whole scheme, which is different. I'm not saying it's worse or better than just, pocketing the cash, the copays, but one of them really takes a lot more effort and planning than the other. So,
Well, what is something that practices can scrutinize? Do they start at their, financial records between looking at discrepancies between income and expenses? Do they look at patient billing and what I mentioned for billing for services not rendered, or, what is it that they need to look at least identify it? If they were bringing you in, what was the first thing that you'd say?
well, I mean, typically, if they're bringing me in, something has been spotted. So, what we really want to do is we want to act really quickly but carefully.
Yeah.
Okay. We don't want to confront somebody. We want to give them a day off or a few days off because we need to get in and we need to get access immediately, right? Before they can change passwords or delete anything. Okay. So, not a lot of warning. We want to bring in somebody with financial expertise. Sometimes it's a simple enough issue that we've spotted that the accountant can assist. Sometimes we need somebody a little bit more specialized, but we want to kind of get our ducks in a row before we let anybody know that something's going on.
Going on, yeah.
Right. And then it may be a review of a couple different things. There's the financial aspect, what was billed, what was collected, the tracking of the cash, the tracking of the vendors, the money charged by credit card, the co-pays, so more like tracking of the actual financials. But then there's the second piece, which you mentioned, which is the billing for services that didn't occur, billing for more than what actually occurred. Those kinds of things, which really cross over into healthcare fraud, right? And put the doctor and the practice at risk in a very different way, not just, criminal, financial fraud and embezzlement, but literally in trouble with payors, Medicare, for actual healthcare fraud, which is, where I really get more involved with the legal piece of that. We may have to do a full analysis. We may need to refund Medicare. We may need to make a disclosure. We may need to do a variety of different things. So that's a separate legal piece. But if we're really just talking about kind of the financial aspects of it, it's really a group, a team effort. I play my role, but the financial partners play a really important role as well, because they dive in and try and figure out exactly what occurred. But, the hardest thing from my perspective typically is that, we very often cannot get access to the financial information. And it could be we don't have access to we can't log into the computer. We can't get into the QuickBooks. We can't get into the bank accounts, And I know it sounds crazy when I say it like that, but it is so common that is the biggest and first obstacle to overcome. So often there's an IT team member as well, who we have to talk to before we can do anything else.
Well, it's funny you said that, because just had a discussion with my husband the other day, because he's my CFO, and he's like, "Did you change your password on your bank account?" And I'm like, "Oh yeah, forgot to tell you, I did." So even those kinds of things, maybe it's just an oversight to tell somebody, but often than not in a practice, yes, it's hard because people don't share that information, don't put it in someplace safe, or you just don't have access to it, and they change it without knowledge. So, okay, so you've identified the problem, you've taken care of it, that, employees either been eliminated in the situation or the situation's been eliminated. So let's backtrack a little bit. Let's say you're being brought in to safeguard against something like that. So maybe preventative measures, or talking to them about how to periodically make sure that there's nothing going on, such as auditing and monitoring and staff training. How do you approach that?
So when we're working with a practice and we're trying to prevent these things from happening, we do very specific things. First of all, we create job descriptions. So everybody has their role. We make sure that there are multiple segregated duties among staff, cross-training, okay? In a small practice, this can be difficult, but then the doctor will need to be the one that's cross-trained, okay? So that is one of the first things we do. We make sure that there's a clear office policy. There's no expectation of privacy. The doctor has a right to go into every drawer, every system, and every file. Okay. The doctor is the sole contact on emails and passwords, and only the doctor can control and change those passwords. Okay. We also need to have policies in place that do things like, first of all, background checks. Can I tell you, most practices do not do background checks on the people they hire, especially if they're given like a referral from a friend. But I have had situations where the same person has stolen from multiple different practices because the doctors can be so embarrassed that it happened to them that they just terminate the person and just like get out of here, they cut their losses, and the person moves on and gets another job and does the exact same thing to the next practice, often very much within the same specialty because that's what they're familiar with. And when you call and you check on somebody's references, often they'll just confirm dates of employment, right? That doesn't tell you that she was fired because she stole from our practice, right? I've actually had people go to jail, come back and get a job, and still the practice will just confirm the dates of service because people are not running criminal background checks. Okay, which, by the way, if you've committed a crime, you're likely on the OIG exclusion list, and every practice should be running an OIG exclusion background checked as well, right? Which they're not. So there's so many opportunities to dig into someone's background that practices aren't taking. And of course, it's the less sophisticated practices that are not doing it properly, but it's also those practices that are having this type of dishonest conduct in their practice, right? So these things are tied together, clearly. So we try and create a protocol, background checks, job descriptions, policies about privacy, segregation of duties, Creating awareness that there's going to be audits, there's going to be financial audits, there's going to be a review of people's jobs, verifying vendors, no new vendors unless they've been verified. Maybe that's by the accountant or by the lawyer or some outside checking on that, right? When somebody goes on vacation, the practice should be able to operate. If a practice cannot operate because somebody's on vacation, you're not following these protocols. There's a problem. That's a red flag right there, right? So we try and talk about these things. And of course, auditing, you of all people know how important that auditing is. We recommend auditing of the records to find the type of things like, billing for services that didn't happen, upcoding, et cetera, things like that, but also the type of auditing of the co-pays and the financial aspect. So auditing is a really key piece of it as well. But that's the kind of plan that we try and help our practices build from the start to protect this. And this is really only talking about the financial side, because there's another piece of this, which is the pharmaceutical side of a practice. And I don't know if you want to talk about that as well, but what I just talked about is really more the billing and financial aspect of protecting the practice.
Oh, wow. Well, you can touch on that. What is it more about theft from samples or actually dispensed meds that they bill for? What are you seeing there?
So it's interesting because of the electronic prescribing.
Yeah.
We aren't seeing really theft of samples. I mean, other people may have that. It hasn't been really the cases that I'm seeing. I see people calling in prescriptions. They may be a nurse or some type of mid-level, calling in prescriptions and picking them up themselves or for family members, and then they aren't recording that. And usually we discover that by receiving calls from the pharmacy. Okay. I have seen problems with the electronic prescribing system where if you put in a prescription and you print it out, but then you cancel it, it's not recorded into the database as having been a prescription, that went through. But you can then take the printout and go to the pharmacy and get a prescription.
Wow.
Okay. I've seen schemes like that I've seen that several times actually. So I mean, I think stolen prescription pads, believe it or not, are still fairly common. So it is actually a pretty significant issue. And the safeguards for that are, watching that prescription pad,
Yeah.
having only one designated person who's allowed to call in prescriptions and checking with the pharmacy to match the logs, right? Only one pharmacy is allowed to be used. If people want to find a way, they're going to find a way. But again, it is, the more checks and balances you have in place, the less likely it is to occur. With that prescribing issue that I mentioned with the computer, we literally had to bring in somebody from the company to put some changes into the system, so that wasn't possible. So there was no way to print out a prescription would come out with like void on it or something like that. But I bet that's happening pretty widespread because a lot of people may not realize that it's a possibility. So
Yeah. Wow. I know that telehealth has been an issue. I know that we've got, and I call them bad actors because it's not everyone, obviously, but it does happen. And when it happens, it's so blatant that it kind of ruins it for everyone. It's, you've heard the phrase, that's why we can't have nice things, is because you've got
right.
this, one person or one bad actor out there that just abuses, the gift of certain things we've been given for reimbursement. And then all of a sudden, you're tagged at, well, this is what's happening. It's like, well, it's not often, but it's often enough where it has to be something that's dealt with. So definitely an issue. Just, in wrapping this up, what would your advice be just for practices, maybe even smaller practices that don't have the corporate, compliance department, just to safeguard themselves? What's maybe the top 3 things you would tell them to do just so they can be at least protected, on the onset when they have a smaller practice from theft and things like this happening?
Well, I would think that almost every problem that I have seen could be avoided by doing your due diligence on anybody that you're hiring and continuing to follow up in conducting annual reviews, background checks, not just getting dates of service, but talking to actual references, running the OIG background check, talking to people who have worked with them, finding out why they left their job. So a very thorough background check. Okay. And then staying on top of the people you hire. Have there been life events or you hearing that they're in debt, et cetera, and watching kind of carefully just to see if there's, changes in behavior and, people give notice, what are they doing, having access to your system when they're about to leave, things like that. Just being very aware of the people that you're hiring and not being too trusting. The second thing is that physicians need to own their practice. Okay. So I know they're busy. The administrative burden is huge, but they need to ultimately, at the end of the day, be responsible, be the ones on top of the emails and the passwords and the bank accounts. They need to be the contacts for the vendors, et cetera, at least initially, and then, make a monthly meeting, with your financial or legal advisors and double check everything's there. But, be responsible. Don't turn over the reins of your practice. I think most of this could be avoided by doing that. And, when I say talking with your legal and financial advisors, having them support you by reviewing what's going on in your practice regularly in order to protect you. You can have all the insurance that you want if there's theft and things like that, and it's going to help monetarily. But the repercussions from a regulatory standpoint are quite huge and way more expensive than any money that you've lost. So by somebody stealing. So I think own your practice. Don't rely on others. It's your baby. It's your business, right? So that would be really the second thing. And the third thing is, I think that, a lot of times people just want to kind of be casual, not have written documents, written policies, written expectations. If you need to just hire a partial HR service or work more with your legal counsel, develop the appropriate protocols for your practice. They are there to protect you. I know it seems like it's just paperwork to a lot of people, but if you use it as a guideline, a roadmap for building a safe, happy practice that's not going to get in trouble, where no one's going to steal and hurt you, that's the way to do it. So I think those are the three categories, that I would focus on.
That's excellent advice, and we definitely appreciate all of that, and I'm sure our listeners also will take that to heart. We'd like to thank Attorney Adler, Ericka, for being with us as our guest today on the podcast, and we hope to have you back soon. To find and contact Ericka, you can go to the NSCHBC website at nschbc.org and click on Find a Consultant and type in her first name, Ericka, with a C and a K, Ericka, or her last name, Adler, Adler, and her information will appear. Also, as a reminder, the nschbc.org website offers monthly free webinars on a variety of topics, as well as a quarterly Medicare regulatory update webinar. I know I just did one in December. Please go to nschbc.org and click on the tab Upcoming Education. I'll be presenting the first quarter 2025 Medicare update webinar on March 25th. Registration is also now open for our winter workshop, Consultants Retreat in January. Again, go to nschbc.org to review the agenda and speakers. That's it for us today, everyone. Make it a great day, a great rest of your month, and thank you for listening to the award-winning NSCHBC Edge Podcast. I'm your host, Terry Fletcher.
Thank you for listening to the NSCHBC Edge Podcast. Join us on the second Tuesday of each month as our consultants tackle the complexities of navigating the business of medicine. You can reach us on the web at nschbc.org, the National Society of Certified Healthcare Business Consultants.